name is Marissa Gonzalez, and I'm a third-year nurse anesthesia student at Florida International University. Thank you so much for taking the time to participate in my Doctorate of Nursing Practice project titled Lavender Aromatherapy Compared to Midazolam for Quality Improvement of Preoperative Anxiety in Elderly Surgical Patients, an educational module. I hope you enjoy. This DNP project aims to propose lavender oil aromatherapy as an alternative approach to intravenous midazolam administration for managing preoperative anxiety and improving perioperative care outcomes for elderly surgical patients who, as a result of increased drug sensitivity with aging, are unable to receive standard psychotropic drug therapies. The learning goals of this project include to explore the medicinal utilization of lavender oil aromatherapy for managing anxiety in elderly patients prior to surgery, to discuss implications of conventional care strategies for preoperative anxiety in elderly surgical patients, to expand understanding of the adverse events and outcomes associated with pharmacological treatment of anxiety with midazolam in older adults, and to consider benefits of lavender oil inhalation and its applicability as an alternative therapeutic approach to preoperative anxiolysis in elderly patient populations. Age-related pathophysiologic changes occur as a function of aging. With age, a continuous decline of the body's homeostatic mechanisms occurs, chiefly in the liver, kidneys, and central nervous systems. The combination of these physiologic adaptations facilitates the accumulation of drugs and subsequently alters the body's response to various pharmacologic agents. Increased drug sensitivity, especially to drugs affecting the central nervous system, may manifest through a variety of symptoms related to cognitive impairment. Geriatric patients, when administered preoperative anesthetics that target the CNS, may experience drug-induced CNS toxicity and thus exhibit signs and symptoms related to altered cognition, including confusion, disorientation, oversedation, motor impairment, and delirium. Midazolam, a benzodiazepine, is the drug most frequently administered to adult surgical patients during the preoperative period for its anxiolytic, sedative, and amnestic properties. While preoperative low-dose midazolam, 1 to 2 mg IV, is customarily considered safe in most surgical patients, its administration to elderly patients over the age of 65 is linked to undesired drug responses. Studies have investigated the link between age and the occurrence of undesired responses to premedication with agents of the benzodiazepine drug class. This link is explained by age-related pathophysiologic changes that occur as a function of aging. Neuropsychological and physiological responses following preoperative administration of midazolam in older individuals suggest that aging magnifies pharmacodynamic sensitivity to this drug. A strong association exists between age and cardiopulmonary functions, sedation, and cognition in response to benzodiazepines. Of the several adverse responses to benzodiazepines documented to occur in older patients, however, postoperative delirium is agreed upon as the most significant complication following its administration. Further, postoperative delirium, irrespective of its precipitating cause, is revealed to be the leading complication in elderly surgical adult patients. Midazolam administration in surgical geriatric patients is correlated with notable reductions in blood pressure and oxygen saturation, prolonged durations of deep sedation, and to the occurrence of residual drowsiness and amnesia postoperatively. Additional evidence relates midazolam premedication in elderly patients to delayed recovery after surgery and prolonged durations of PACU stay. A recent study conducted in older adults revealed that intravenous midazolam 2 mg produces significant deficits detected by functional imaging changes and cognitive testing. The administration of benzodiazepines to elderly adults in the preoperative period may also produce postoperative emergence delirium and cognitive dysfunction. Importantly, postoperative delirium is the #1 documented complication in elderly patients following surgery. Age and medications are independent risk factors for the development of delirium. Therefore, when coupled, markedly increase the likelihood of its occurrence. Medications have a documented association to as much as 39% of delirium cases in elderly medical and surgical patients. Postoperative delirium is a significant and consequential adverse response to midazolam premedication in older adults that may detrimentally impact morbidity and mortality rates and increase hospital length of stay. Owing to the numerous documented adverse drug effects of midazolam administration in older adults over the age of 65, pre-surgical treatment of anxiety with midazolam is routinely not recommended in this patient population. Consequently, the presence of anxiety in these elderly patients is often left untreated before surgery. Untreated preoperative anxiety is linked to increased post-surgical pain and analgesia requirements, immunosuppression, impaired wound healing, worsened mood and satisfaction, and prolonged length of hospital stay. It is very important to remember that postoperative delirium is the #1 documented complication in elderly patients following surgery. The main benefit to you as an anesthesia provider from this QI project is an enhanced knowledge related to utilizing lavender oil aromatherapy for quality improvement of preoperative anxiolysis in elderly surgical patients. In comparison to medications administered intraoperatively that are dictated by the surgical procedure and immediate patient's needs in response to surgery, the choice of a preoperative drug regimen can be potentially modified to reduce the risk of delirium or other adverse postoperative complications following surgery. Understanding the impact of untreated pre-procedural anxiety on postoperative surgical outcomes is imperative for enhancing perioperative patient care and experiences in special surgical populations, specifically older adults. Despite numerous knowledge-based concerns, benzodiazepines prevail amongst the top psychotropic medications prescribed in elderly patients aged between 65 and 80 years. Knowledge on the crucial relation of preoperatively administered medications to postoperative adverse complications is vital for preventing harmful medication-induced health outcomes and expediting surgical recovery in elderly patients. Presently, the preoperative care of elderly surgical patients does not include alternative strategies to benzodiazepine administration for the prevention or treatment of anxiety before surgery. Owing to the wealth of adverse drug effects known to follow benzodiazepine administration in adults over 65 years old, safer anxiolytic therapies are mandated to optimize their health outcomes. Methods that therapeutically address the presence of anxiety before surgery without the negative effects of traditionally used psychotropic agents must therefore be strategized for perioperative care of older patient populations. Aromatherapy is a prevalent form of complementary and alternative medicine that utilizes essential oils extracted from aroma plants for medicinal purposes. Essential oils like lavender are volatile compounds that, when inhaled, can produce a variety of beneficial physiologic and psychological effects. Essential oils used during aromatherapy can be absorbed into the body by the skin following topical application or by the olfactory system after inhalation. Lavender oil is reported to maintain distinct therapeutic and curative properties that enable its use within holistic treatment approaches for burns, muscle spasms, infections, insect bites, and many neurological and psychological disorders. A total of 8 studies met the established inclusion criteria to be selected for critical evidence appraisal. The efficacy and safety of lavender oil inhalation and benzodiazepines were compared and assessed across diverse healthcare settings. The evidence-based literature collected demonstrates lavender aromatherapy as a beneficial alternative to midazolam administration for preoperative anxiolysis in elderly surgical patient populations. Findings from both animal and human studies concur on the analgesic, sedative, anxiolytic, anticonvulsant, antidepressant, and neuroprotective properties of lavender oil, and on its usefulness for neuropsychological purposes. Although oral administration of lavender is typically recommended, lavender oil has been proven to be clinically effective when employed via aromatherapy techniques. Linaloyl acetate and linalool, the main chemical components of lavender oil, when inhaled, act upon the limbic system of the brain, specifically the amygdala and hippocampus, to produce therapeutic effects. Lavender's major ingredients are considered responsible for producing anxiolysis with minimal side effects, rendering lavender the superior essential oil for treating anxiety. Evidence-based literature establishes that lavender oil relieves anxiety, reduces mental stress, and promotes sedation and good sleep. Investigation into the anxiolytic effects of lavender aromatherapy across several patient populations, application types, and outcome measures conclude lavender inhalation to be a safe and affordable strategy for relieving anxiety. Collectively, the evidence supplied by the 8 included research articles supports lavender oil aromatherapy as an alternative method of preoperative anxiolysis in elderly surgical patients.